Hi, this is the first of my video journal where I'm going to share the ins and outs, the trial, the tribulation, my fears, both secret and otherwise, as I journey toward my knee replacements. One of the things I've seen on the internet and in books is that there doesn't seem to be a lot of personal experience. I'd really like to see what the scars look like and maybe some information about what people did or didn't do right. And so hopefully I will post this and other people will be able to follow, and it'll help them in this very important and a little scary, this journey. So anyway, my name is Holly. I am 45 years old and I am scheduled to have knee replacement surgery on February 24th, about 10 days from now. And today is, as if you've done the math, you figured it out, it's February 14th. Why am I having this surgery at this young of age is that I have both knees that are pretty arthritic and bone on the right knee and pretty bad on the left knee. I have been in pain for at least 10 years that I can remember, and it has gotten progressively worse, and in the last 5 years it has deteriorated to the point that I'm having a difficult time enjoying my life. I stay inside a lot, and when I do go out I'm using a cane, and it's just way too early to be using a cane at this juncture. So as I said, I'm having the surgery on February 24th. And at this point, I do not know if I am having a partial or a full knee replacement. The doctor is going to start on my right knee, and then if that knee will support and the bone quality is good enough and they feel that I'm still a good candidate, then they're going to do the partial on the right knee, and then they will start on the left knee, and if that knee will support a partial, then they'll do a partial. Now, if they open the right knee and it will not support, or I'm not a good candidate for a partial, then they will do a full and then they will stop. Now, there is a very small and remote possibility that they will do a partial on the right, then they'll open the left, and then that knee will be worse than they think it is by all the images, and then they may go ahead and do a full on the left. So I don't know what I'm going to wake up to when the surgery is done, but I do have faith in my doctor, and I've been told that he is one of the best in the country, and in this area people fly in, I guess, from all over to have the knee surgery done at this particular surgery center. So I feel very comfortable. I've already had my orientation, which was very eye-opening. And I was glad I went, and also I came home with a lot more information, and it was a little sobering. So I think I'm ready. I've gone back and forth, and at this point I'm ready. But I have had some major anxiety, so I'll share that with you. So I've never thought of myself as a person that had a lot of anxiety, but I guess it happens. And I got very, very anxious, mood swings, irritability, started actually giving stuff away, like I felt like I was going to die, which is a little embarrassing. But they tell me all this is in the realm and the spectrum of normal, so I'm not supposed to feel bad about it. So I'll just share that with you. You might be feeling some anxiety as well, or you may be trying to help someone through a knee surgery, and I'll just warn you that, boy, sometimes your emotions are all over the charts. So what have I done to prepare at this point? Well, I am kind of sketchy. I do good some days, other days I don't, but I'm doing my pre-exercises, and on the next video blog, I'll show you what those look like. And I switched from changed my diet to try to get under 2,000 milligrams of sodium, which apparently will not only help my blood pressure, which was a little high when I went to the doctor, but it will also help with water retention and swelling in the future. On Monday the 8th, I was taken off of all pain medicine and Aleve or any other kind of analgesic. Apparently there's some problems with thinning of the blood, and it's just better for your liver during the surgery with the anesthesia if you don't have that all. in your blood system. So all week I have been feeling the full effects of the arthritis in the knees, and wow, I really did. It's been years since I've been completely medication free, so I didn't completely feel the impact of the damage to my knees, and which I have been feeling. So I'm even more ready and full of anticipation to get this taken care of and to get on the other side of the knee surgery. So I think this is enough for my first entry, and look forward to more. I want to take some video in the hospital. I want to show you what it looks like before and after. So all of you out there in video podcast land, you'll get to see my knees. So that's just a little anticipation. And if you are taking this journey with me, I do wish you well and peace and all the serenity that you can gather during this time, because I know how valuable that is. I'm just going to sign off for now, and follow me on this amazing, scary, but important and hopefully life-changing journey.